Okay. Can you also explain a bit more on the difference between HRT and topical estrogen? Um, yes, okay. I did have some slides on this. Let me see if I can find it. 1 second. All right, so it's a good question. So HRT is, we consider that very different to topical estrogen. So HRT is essentially working throughout the body. Topical estrogen is just acting on the estrogen receptors in the vagina and the urinary tract and the vulva. So HRT is a type of hormone therapy containing estrogen alone or estrogen and progesterone. So in someone who has had a hysterectomy and they don't have a uterus, you can give them estrogen only HRT. If someone has a uterus, you have to give, if I gave them estrogen only, their symptoms would improve. But what would happen is the lining of the womb would thicken and predispose them to cancer of the lining of the womb. So anybody who has a uterus will need estrogen and they will need progesterone to protect the lining of the womb. So that's all HRT is. What is estrogen? So we call that an oil to the body. So it will treat the menopause symptoms. It will protect against osteoporosis, Alzheimer's, coronary heart disease. It will improve skin and collagen. It improves vaginal and bladder health, and it will reduce anxiety and depression, right? And these are the types of estrogen we have. So you have a gel. So the gel, you use it daily. You will put it on your thigh or your upper arm. So that's quite common. You have a spray. The spray is called Lenzetto. So again, you would use that daily. You put that in the same spot every day to get the correct absorption. Most popular in Trinidad and in Barbados, well, the one that I prescribe the most is the patch. So the patch, you'll wear it continuously. So you'll always have a patch on. You will change it twice a week. There are also estrogen tablets that you can take. So that's kind of old-fashioned HRT these days, because the problem is if you give oral estrogen to a woman, it will increase, when it gets to her liver, it gets broken down into clotting factors, and that will increase her risk of having a blood clot. So as we get older, as we put on weight, we get higher blood pressure, our risk of having a blood clot increases anyway. So if you add oral estrogen to the mix, you will have an increased risk of having a blood clot. That's why we've moved away from it, because if you give estrogen through the skin, there's no increased risk of blood clots. Progesterone, again, I said it protects against cancer of the lining of the womb. Some of you may have had progesterone before. If you've, say, had heavy bleeding, you were probably given progesterone to stop the bleeding. We have natural progesterone now, which reduces anxiety and improves sleep. So we use that quite a lot, what we call body identical. So here you have the body identical progesterone. So that's a tablet you take at night. So women who have insomnia can really benefit from this because it gets them to sleep a lot better. In women who are perimenopausal and having lots of problems with bleeding, but who still need contraception, Mirena IUD, we can use that. It's licensed for 5 years as the progesterone component of HRT. So I use that quite a bit as well. You have a patch that has estrogen and progesterone in it at the same time. And you can also use the progesterone-only pill, which is similar to the contraceptive pill, as your progesterone component of HRT as well. And I think the next slide is about testosterone. Okay, so that's HRT in a nutshell. So you can use the topical estrogen with the HRT, or you can just use the HRT on its own, or you can just use the topical estrogen on its own. Completely up to you.